Hi, my name is Andrea, and today I'm going to be going over my pharmacology drawings for endocrinology. I am a PA student, and these drawings are just my versions of Picmonic or Sketchy. They're just quick drawings to help you remember drug names, their mechanism of action, and then any adverse effects. So it is a pretty bare minimum amount of information. And then just full disclosure, I do get some of my ideas for these drawings from things like Osmosis, Cram the Pants, and another YouTube channel called AJ Monix. So those are all great resources that you can check out as well. And then also, a lot of these drawings are not my original artwork. I find them from the internet and just adapt them for what I need. And so today, like I said, we're going to be talking about endocrinology. I'm going to be discussing drugs for diabetes, and then just a quick little bit about hypothyroidism, and then Cushing's and Addison's disease. So we're going to get started with the insulin. So just a reminder, insulin is for type 1 diabetics and also for type 2 diabetics if they've had diabetes for a while and their pancreas decides to just stop working. But so looking here at the top, we have this nice graph. So there's different types of insulins. You have rapid, you have short, you have intermediate, long. And so we'll begin with our rapid acting insulins, which are aspart, lispro, and glucine. So lispro, we have a lizard who's a skateboarder. He's a pro skateboarder, and he's hopping off this big ramp here, this rapid ramp. And so that's lispro, so a rapid acting insulin. Then we have glucine, so a lysine, and it's kind of got a rocket here because it's rapid acting. And then we have aspart, so we have an ass, a donkey. He's giving a little thumbs up to the limousine, saying all systems are go. He's parting the way for the limousine. Aspart. So these are all rapid acting insulins. Then we move on to our short acting insulin, which is it's just called regular. And when I think of regular, I think of a gas pump. So we have gas pump. NPH don't have a picture for because there's nothing super special about NPH. And then we have Detamir. So this guy, he's been in debt for a long time. So Detamir is a long-acting insulin. Next, we have glargine. So we have a gargoyle. Think of gargoyles are usually on really old buildings that, again, have been around for a long time. So glargine, I think gargoyle, kind of long acting. And then finally, we have degludec. So a deck of cards, degludec. It's the longest acting one. And feel free to pause the video, take a look at this chart down here. It just summarizes the graph, which tells you the onset of these insulins, their peak, their duration, kind of what they are used for, and then if they're sub-Q or IV or both. And then also in the bottom right corner, we just have some notes about things that would slow the absorption or speed up the absorption of insulin. So next we'll move on to drugs for type 2 diabetes. And so we're going to begin with your first line for all type 2 diabetes, metformin. So that is shown here by this Mets baseball player. And the mechanism of action for metformin is that it decreases production of glucose in the liver, which is gluconeogenesis, and improves insulin sensitivity in skeletal muscle. So how do we remember this? This is a lake that is shaped like a liver. And this little cube here, that's a sugar cube, and it's decreasing. So we are decreasing the production of glucose, sugar, in the liver. And then in addition to that, it improves insulin sensitivity in skeletal muscle. So anytime I mention insulin, I have it shown here by an insect because insect, insulin, they both start with the first three letters. And so this insulin here is kind of by this baseball dude's, his skeletal muscle. So improves insulin sensitivity and skeletal muscle. Adverse effects are nausea. So he's kind of throwing up here. he's nauseous. Diarrhea, we have a poop symbol. Weight loss is shown here with these trees. So these trees are starting big, they're getting smaller, weight loss. Anorexia is not really shown, but that can kind of go with weight loss. And then lactic acidosis. So again, this liver is a lake with a lemon in it. Lemons are acidic, so lactic or lactic acidosis. And then just a pro tip, this drug needs to be adjusted for EGFR or your patient's renal function. So they can still take it if they have poor renal function, but it needs to be appropriately managed. Next, we'll move on to the sulfonylureas. And so this is shown with a cell phone that is urinating, sulfonylurea. Mechanism of action is to increase insulin from the pancreas. So I have this little bush here that looks like a pancreas, and there are insects coming out of it. Increases insulin from the pancreas. There are 3 drugs in this category. We have glipizide, glyburide, and glimepiride. They all start with G's, and so these G's here, they are hiding. They're either hiding from the hippo or they're hiding from the cell phone that's peeing, and so they all end in "ide." They're hiding, they end in "ide," they all start with G's, and then going back again, we have glip. So this one has big lips. We have glybur. This one's cold, he's saying burr, and then this one's holding a line for glyme or glimepiride. Adverse effects are hypoglycemia, so a hippo for hypoglycemia, and weight gain. Think hippos are fat, hypo, weight gain, you got it. Next is the meglinotides, and there are 2 drugs in this category. Nataglinide, also known as Starlix, so we have a star, that's the brand name. And then repaglinide, so he's repairing something, repag, with a wrench. Mechanism of action is the same as the sulfonylureas. It's increasing insulin secretion from the pancreas. And so we have this hippo, and at the end of his tail kind of looks like a pancreas. There are insects coming out of it. And so even though this has the same mechanism of action as the sulfonylureas, it is not the same thing. These are a separate drug category. They also have the same adverse effects of hypoglycemia and weight gain, but just remember they're slightly different. They're more shorter acting than the sulfonylureas. Next, we'll move on to the alpha glucosidase inhibitors. So the drugs in this category are acarbose or a car bus, and then miglitol or a tall mug. The mechanism of action of this is that it delays hydrolysis of polysaccharides to the large intestines. So think about the mug. You drink things, you eat food out of mugs. And if this car bus was to crash into it, it would delay you from getting that food into your stomach. It would delay the hydrolysis of polysaccharides in your large intestine. And so adverse effects are flatulence. So it's not shown very well, but this mug is farting. And we have diarrhea again, hepatitis, that's liver. And then a key point here, if your patient who's taking these drugs becomes hypoglycemic, you need to give them plain glucose because any other glucose would be inhibited from getting to large intestine and therefore it wouldn't work. So next we'll move on to our, I'm not even going to try to pronounce this, they're abbreviated TZDs or the glitazones. And there are 2 drugs in this category. Pioglitazone, so we have a pi, and rosiglitazone, we have a rose. Mechanism of action is to reduce insulin resistance and improve the action in tissues. And then it can also improve storage of glucose as glycogen, but we'll focus on the first sentence here. So we have this box of tissues, which is, again, think more about the tissues that are in your body, but because there is reduced resistance, this insect, the insulin, is able to get inside of the box of tissues. The insulin is able to get inside your tissues and therefore reduce your blood sugar. So adverse effects are peripheral edema. So that is shown here by this pie's legs, because he's got like really tiny arms, but he's got really fat legs. And that kind of goes with weight gain too. He gained, and also if you ate lots of pie, you'd gain weight. And then increased coronary events. And so think about roses. You give those around Valentine's Day. Valentine's Day has to do with lots of hearts, heart, coronary. Hopefully you get the point there. Next is our SGLT2 inhibitors. So SGLT kind of looks like soldier if you use your imagination. And so we have a toy soldier here representing SGLT2, and he's frozen because all the drugs in this category end with the word flosin. So we have a can for canagliflozin, a dirty bag for dapagliflozin, and then an empanada for empagliflozin. So all of these inhibit SGLT2, which lowers the renal threshold for glucose spilling into the urine. So basically what's happening here is you have all this excess blood sugar, and it's just going to be eliminated through the kidneys, through your urine, to try and get rid of it. And so adverse effects are glucosuria. So basically you have so much sugar in your urine that it's becoming like syrup, which is why we have someone putting syrup on their empanada, because, you know, like I said, your urine is just like syrup. Other adverse effects are genital urinary infections, which makes sense because if you have a lot of sugar in your urinary tract, bacteria is going to use that sugar because it needs sugar to grow as well, and it's going to become opportunistic and set up shop there. And then dehydration, because you're just losing so much fluid by peeing constantly. And then just a little side note, this is a weight neutral drug. So like I said, a lot of these other ones, they cause weight gain, such as all these ones that we've just discussed. This one, your patient should not lose or gain any weight. And then finally, we will look on this page at the DPP4 inhibitors. So DPP kind of looks like the word dip. So think you put dip in your lip. Dip is tobacco, usually comes in tins. And so all the drugs in this category end in the word tin. So we will start over here. We have alogliptin, so an aloe plant for alogliptin. We have a saxophone for saxagliptin. Linen on a line for linagliptin or linagliptin, and then a chair for sitagliptin. Mechanism of action for these drugs is that it blocks the action of DPP4 . All right, so going back to this, we have linen on a line for linagliptin. Yeah, we covered that already. Okay, so mechanism of action here is that it blocks the action of DPP4, which is an enzyme that destroys incretin. Incretins can increase your insulin production. So incretins are just this molecule in your body that is helping out. It's working with insulin to decrease your blood sugar. And then normally DPP4 destroys incretin. And so with this drug, it's going to help prevent those incretins from being destroyed. Therefore, they can still work with insulin to do their job in decreasing blood sugar. So incretin, ink, is shown here with this ink bottle. So the last drugs on this page are our DPP4 inhibitors. So DPP looks like the word dip. And so remember, you put dip in your lip. So dip is tobacco. And you put it in your lip. Tobacco comes in tins. All of these drugs end in lip tin. So we'll start over here. We have an aloe plant for alogliptin, a saxophone for saxagliptin, linen on a line for linagliptin, and then a chair, because you sit in chairs, for sitagliptin. So the mechanism of action for all of these is that they block the action of DPP4, which is an enzyme that destroys incretin. So you might be thinking, what is incretin? Well, incretins increase insulin production. They work with insulin to decrease blood sugar. And so normally there's this thing floating around in your body called DPP4, and it destroys incretins so that insulin doesn't have as good of an effect. And so with the DPP4 inhibitors, it is inhibiting incretins from being destroyed. So I have an ink bottle here to remember incretins. So adverse effects are hypersensitivity and pancreatitis. So on this shirt here, we have this sad, sensitive face and a pancreas for pancreatitis. And then this is another weight neutral drug. So then we will move on to our GLP-1 agonists. Think GLP, gooey laundry pods, so Tide Pod, and then also all of these drawings takes place on the sea shore where the tide comes in. All the drugs end in the word tide. So we'll start over here. We have a really dull looking pencil. It's not very sharp, so dull glutide. We have a big X for exenatide. We have a semi-truck for semaglutide. And then this hippo here, he's singing some lyrics, singing a song, so lyrics, liraglutide. The mechanism of action for all of these is to suppress postprandial glucagon secretion, slow gastric emptying, and then increase insulin secretion in the presence of glucose. So we'll start with the first thing here, suppress postprandial glucagon secretion. So postprandial means eating food. So this dude, he just ate a lot of food. And so it's not really shown, but it's suppressing glucagon secretion. Slows gastric emptying, that's shown here in the clouds, slowing gastric, your stomach. And then increase insulin secretion in the presence of glucose. So there's this plate that this guy was eating off of. There's a little bit of, we'll say, glucose left on the plate. And there's insulin present. There's insects. They're cleaning up the rest. Adverse effects are hypoglycemia. So again, we have our hippo here. And then here's where you got to be a little bit careful because we have anorexia. With them, some of the other drugs that had hypoglycemia, their adverse effects were weight gain. This one's anorexia. Nausea is not shown in the picture. And then pancreatitis is shown over here with this wonky looking palm branch that looks like in the shape of a pancreas. Next we have pramlintide, so a RAM for pramlintide. And this, you gotta be careful here because it's not a GLP-1 agonist, even though it has the same mechanism of action. So it suppresses postprandial glucagon secretion and slows gastric emptying. So this RAM is eating postprandial, slows gastric emptying, also has the same adverse effects of hypoglycemia and anorexia. But again, it is not a GLP-1 agonist. Next is glucagon. So we have a glucagon, or glucagon, and this stimulates gluconeogenesis and glycogenolysis in the liver. So this is actually increasing your blood sugar. Drug names are Beximi, brand names. And then adverse effects, they're not shown in the picture, but it's nausea, vomiting, injection site reactions, hyper and hypoglycemia. To remember injection site reactions, you could think that this glue gun looks like it's about to inject the liver with something. That might help you out there. And then moving on to this picture, we're going to talk about drugs that treat DKA, diabetic ketoacidosis. So just as a reminder, diabetic ketoacidosis occurs usually in type 1 diabetics when their blood sugar gets so high, but their body still thinks that it's starving. And so it's breaking down lipids instead. The lipid breakdown is causing ketones to release into their bloodstream and they become acidotic. So to treat this, you want to start with IV fluids. So 0.9% normal saline, and then you don't want to decrease their blood sugar too quickly because that would be bad. So once their blood sugar gets to be about 250, you're going to add dextrose to that IV. You also want to give them IV insulin to, again, decrease the amount of sugar that's in their bloodstream. And that's going to be 0.1 units per kilogram bolus, and then you would give another 0.1 unit per kilogram per hour after that. And then potassium is very important. You want to keep that above 4.0. So there are 4 bananas here to help you remember to keep it above 4.0. And we'll talk just very briefly about drugs that are safe during pregnancy. So if you have a patient with gestational diabetes, your first line management is going to be with proper diet and exercise. If that didn't work, you could move on to metformin. You could try glyburide, and then of course, insulin is safe as well. Those are the only drugs that are safe during pregnancy: insulin, metformin, and glyburide. So that finishes up diabetes, and now we're going to move on to some hypothyroidism drugs. So we're going to talk about thyroid supplementation. So all of these increase basal metabolic rate and the use of glycogen stores. They promote gluconeogenesis and stimulate protein synthesis. So the main drug that you're going to see here is levothyroxine, which is T4. So we have a basil plant here to help you remember basal metabolic rate. And basil plants have leaves on them. Leaves for levothyroxine. There's rox here, so roxine. And there's 4 of them to help you remember that levothyroxine is T4. Next, we have leothyronin. So this is the zodiac symbol Leo. And there are 3 people here for T3. One of them is being eaten in half because leothyronin has a 1-day half-life. So one of these people was eaten in half. And that is opposed to levothyroxine, which has a much longer half-life of about, I believe it's 6 to 8 days. Another option for your patients with hypothyroidism is to give them Leotrix, which is a combination of T4 and T3. So I have this Trix yogurt here. So Leotrix yogurt. This came in these packs where you could have 2 flavors. And so T4 and T3 comes in a 4-to-1 ratio. So 4 T4 to 1 T3, which I tried to show here by these different colors, even though it kind of looks more like a third, but you get the point. Other options are called desiccated or armor thyroid. And so these are thyroid hormones that come from cows and sheep and pigs. And this pig is wearing armor to help you remember that it's called armor thyroid. And the main point here is that it's a T3 and T4 drug that's coming from, like I said, dried thyroid glands of these animals. And it's very unpredictable of how much you're actually getting. The concentration can vary from each bottle. And so while it is a natural version of levothyroxine, you're not always sure the exact dose that your patient is getting. And so adverse effects for all of these drugs is your typical signs of hyperthyroidism, because think if you're giving too much T4 and T3, well, then you're going to have hyperthyroidism, which is signs like nervousness, tachycardia, heat intolerance, weight loss, and then thin skin. Also, it's very important to remember that your patients take these on an empty stomach because they are absorbed best in an acidic environment And if they are eating food, they're not going to be absorbed very well. So next we'll move on to two drugs that are for hyperthyroidism. And so here we have this picture. We have a granny, she's farting, and this pregnant lady is standing next to it. So what's going on in this picture? Well, granny here is getting something out of a tap. So tapazole, or also better known as methimazole. And this stuff that's coming out of the tap here, it's yellow, it's kind of gross. It looks like iodine. And so the mechanism of action for methimazole is to inhibit iodination of thyroxine precursors. So someone here should be telling Granny, like, hey, stop it. Don't be drinking iodine out of this tap. They should be inhibiting her, just the same way that the mechanism of action is to inhibit iodination. She's a granny because the adverse effects are agranulocytosis. And then you can see her liver here for hepatotoxicity. So while Granny's over here drinking out of the tap, she farts. And this pregnant lady is like, PU, that stinks. PU, PTU, propylthiouracil. So this mechanism of action also inhibits iodination of thyroxine precursors and then blocks the conversion of T4 to T3. So that is shown here on her boobs. T4 is being blocked into T3. And it's very important to remember that this drug is used during the first trimester of pregnancy. After the first trimester, you can move your patient to methimazole. That can be used during the second and third trimesters. Adverse effects are still a granulocytosis, a rash, so she has a rash on her arm, and then hypothyroidism. So just like how the drugs such as levothyroxine, if you took too many of them, you got hyperthyroidism. Well, with these drugs, if you're not taking them appropriately, or even if you are taking them appropriately, they could rebound and cause the opposite effect. Next, we're going to talk about propranolol. So this is something that treats the symptoms, mainly the symptoms of hyperthyroidism. And so it's a beta blocker. So we have a beta fish. Let me back up a second. This is a propane tank for propranolol, and it's saying LOL for propranolol. And there's a beta fish on it because it's a beta blocker. So it's going to slow your heart rate and block the conversion of T4 and T3. So we have some blocks here. There's 4 blocks here, 3 blocks here. It's blocking the conversion of T4 and T3. Adverse effects are bradycardia, so again, slow heart rate, hypotension, low blood pressure, and then bronchospasm, which is not shown in the picture. Although I suppose if you were laughing really hard, you could have some bronchospasms. Next drug we're going to talk about is just plain potassium iodide. So this is a drug that is used in preparation for radioactive iodine or surgery. And it just works by using negative feedback. So we have a banana, it's potassium, and he's sitting on a surgery table. Adverse effects are diarrhea, paresthesia, so we have pins and needles, because paresthesia is when you start feeling numb. Hypersensitivity, he's very sad. He's sensitive about something, probably the pins and needles. And then hypo or hyperthyroidism. So that is shown here by this thyroid with an up arrow or a down arrow. And then lastly, we're going to talk about etomidate. So etomidate is a drug for Cushing's syndrome. So Cushing's is when you have too much cortisol. And so the mechanism of action is that it's going to inhibit corticosteroid production in the adrenal gland. So this is Tom for etomidate, and he's holding some dates, dried fruit dates for etomidate. And he's holding a gavel, at least he was holding a gavel until his arm spasmed. So gavel represents cort or corticosteroids. And adverse effects are hypnotic, so he's got crazy eyes, myoclonus, which is this muscle spasm, apnea, that's not shown, hypotension right here, And then cardiac suppression. So these dates are kind of in the shape of a heart. They're being suppressed. So those are the adverse effects. And just to go over it one more time, hopefully it makes sense. His muscle spasmed because of the myoclonus. He dropped the cort. He inhibited corticosteroid production in the adrenal gland. And then there's no more pictures here, but these are just some important notes. For Addison's disease, you would use hydrocortisone and fludrocortisone. It's probably very important to remember the short-term adverse effects of corticosteroids, such as hyperglycemia, increased white blood cells, psychosis, GI symptoms, sodium and water retention. And then long-term adverse effects of corticosteroids are osteoporosis, cataracts, thinning skin, fat redistribution, and then your hypopituitary excess suppression. Radioactive iodine 131 can be used for hyperthyroidism, so that would ablate the thyroid. These are just some vocab terms. And then again, in DKA, if you were to run some labs, this is what you would see. And so, yeah, that is a summary of all of the endocrinology drugs. I hope that was helpful.